Now, many of you will know Dr. Nick Hicks. He was the chief executive of Primary Care Trust in those days, if you remember them. They're not that long ago. And part of the whole movement into the change in the way that health is structured. So you were very much on the edge of that happening, were you not? And he was also our public health director. So he knows our town well. He is now liberated into a whole new consultancy of ideas and change management and offerings, and as he is chief executive of Cobic, is that the right name, Nick? So he's going to give us his inspiration on how we can change and develop.
Thank you, Francesca. Francesca and Stephen, thank you very much for the invitation to come back to Milton Keynes. It's a real pleasure, and it's fantastic to see so many friends and colleagues in the audience. And I had a fantastic time. I had lots of happy memories, and so it's a real pleasure to be back in this great place. I'm not sure I want to thank Stephen for the title, for the good ship Milton Keynes. But when we spoke, he said, please, did I say something about commissioning in the context of a council, particularly that aspires to be cooperative? I think that was broadly my brief. So that's what I've tried to do. And I now run an organisation called Cobic, which helps to get better value for the taxpayer and hopefully better outcomes for individuals and their communities by focusing on the outcomes that really matter to people. And that's really what I'm going to talk about. And I mean, the context, I think, in which some of this starts is, I'm a doctor by background and worked 30 years in the health service, and I'm hugely proud of the health service, particularly its aspirations. A country that wants to give its citizens universal access to a service free at the point of delivery, resource allocated according to need, not ability to pay, and funded progressively out of taxation, so the rich pay more and the poor consume more, and the working well support the frail elderly, I think is a fantastic, fantastic aspiration. And of course, it was one of the five elements of Beveridge's vision for a welfare state, designed to slay those. Remember those dragons of ignorance and poverty and squalor, and that was where our welfare state came from. But although I'm proud of both the welfare state, perhaps not in its current meaning, but its aspiration, and the health service, I'm not always proud of what happens now in its name. There are the scandals with which we're all familiar, but it's not just the scandals of the Staffordshires or the Winterbourne views for social services, but it's the day-to-day variability of quality. Sometimes it can be fantastic, but other times it can be pretty ghastly, and people get lost, and so I'm not always proud of that. And of course, there's the questions around affordability and waste and all those other bits and pieces. And I think partly because of that, there's a growing consensus that significant change is required. But I'd just like to remind people of one of the reasons that change is required, and I think it's one of the great unsung successes of the 20th century. It's this huge increase in expectation of life. At the turn of the century, this is a graph from 1912 or so, expectation of life of a baby was between 50 and 55 years, a boy or girl. And by the turn of the century, it was approaching 80, and we're now into the 80s. So a huge, huge increase in expectation of life at birth, and we should celebrate that, I think, although too often it's presented as a problem. And people say, well, how do we afford our pensions and all the rest of it? Well, actually, that's a fantastic problem to be having. And I think the other bit that is important, I think, is to understand what that's done. The way that was achieved was in the first part of the 20th century. It was largely about reducing deaths from infection and from respiratory disease, i.e. diseases of children, babies, and relatively young adults. So the consequence was that more people reached the ages of 65 rather than, once you got to 65, living longer. But in the second half of the 20th century, we began really to make impacts on the diseases that affect the older population, particularly the cardiovascular disease and stroke. And just to show you that, there you are. The top lines are the cardiovascular disease. You see, largely the second half of the 20th century, whereas the first half of the 20th century was all about reducing infection and so. But the consequence of that is it's a relatively new phenomenon, and this is expectation of life at 65. So but when you get to 65, in the first half of the century, it was relatively flat, but it's only the second half that people have been living many years longer. So there's a big structural change to society in which we have people, not just more people reaching 65, but 65-year-olds living many years longer than the welfare state was designed. Remember, this welfare state was designed Beveridge 39 in 1940. A huge difference in what the welfare state has got to achieve. And I think it's that really drives the problems we're facing now. Because if you take the health service, if you take the problems of people with multiple diseases and try to put them through the system designed to look after appendicitis and broken legs, A, it's the wrong service for them, and B, you gum up the old system. So essentially, we've got that sort of, that's part of what's going on. So we need a new way of supporting and getting people to live the best from those additional years, which we need to celebrate. And there is, I think, beginnings of an emerging consensus of what that new system needs to look like. We certainly need new approaches to help citizens achieve their goals, to make the most of their additional years. And that means new relationships with service users, much less the public rightly are much less deferential, and it should be a much less paternalistic relationship. And the demography is simple. We can't deliver it all through paid-for services. We need We need much more self-care and informal care to help people through life. And again, be more proactive and preventive. You can see all those things that I think people would recognise now as needs to be part of what we move the system to. And at the end, we built in at the very beginning huge divides between health and social care that the public don't recognise, in the health service, between GPs and specialists, between mental health and physical health. So there's some really quite big chunky things that we need to do differently. But there are relatively few ideas about how to make that happen. So lots of people, I think, would recognise many of those things, but not say, so how are we going to make it happen? And I think I see three things as big ideas floating around the system. One is this refocusing on the outcomes, because the outcomes are contributed to by many different people, and we'll talk a bit more about that. Also the idea that actually we need to think about systems, not little fragments of bits, but actually how the various pieces fit together to grow up to make something that's bigger than the whole. And the Devo-Manc thing, greater devolution to local communities, I think will be a big theme. So this idea of a council, the devolution bit, that is able to work cooperatively, focusing on outcomes and thinking about systems, seems to be potentially a very powerful way forward. Now, commissioning is what I asked to talk about. Within that, I think it's helpful to think, what is a commissioner's role? I could have gone through all the dictionary definitions, but there's something about commissioning not being the over-specification of things, but saying this is what we want, and recognising there's expertise in the providers to design the detail. You commission a painting. You don't tell the painter how to do which drawing, it's the style you might ask, or the subject, but you commission a ship. I don't think, well, perhaps they do specify the last detail of a ship, but there's a... anyway, but you get the point. And within that, it's about turning, I think, taxpayers' money into the outcomes that matter for your community. But not just the outcomes, it's about getting the biggest bang for your buck, the best value, the biggest... and that's made more explicit, I think, in the current set of regulations. So a primary care trust, a clinical commissioning group, gets a Freudian slip there, gets money for a population and a set of outcome frameworks against which to deliver a report. Same in the local authorities, social care outcome frameworks, and so forth. And the commissioner, I think, first and foremost, needs to be the agent of the public. They're there to spend the public's money, so need to represent them as taxpayers and also as service users. And again, I'd suggest that perhaps commissioners haven't invested enough in that agency relationship. And again, if they're putting money into the system, they need to do so in the way that puts the right incentives into the system. And again, I think there's lots of examples where that isn't the case at the moment. Lots of people ask, if we're going to refocus on outcomes, what an outcome is. And this is my favourite definition of outcomes, very simple. It comes from a Boston-based group called the International Consortium for Health Outcomes Measurement. simply the results that people care about most, including functional improvement and the ability to live productive lives. And indeed, when you talk to people about what outcomes matter to them, they tend to describe them in functional and social terms. So if you ask older people what do they want from the system, they will say things like, we would like the system to help us stay independent, and if we get sick, to recover our independence as comfortably and as possible. It's not, by and large, if you ask health professionals what their aims are, they wouldn't use that same sort of a language. So I think really important to go to the language the public actually want. And then putting those various bits together. This is a diagram we often use to help people think about their system as a whole. And if you take the blob at the beginning, a good place to start is to have a dialogue with your public or your groups of public, whether it be children or older people or people with mental illnesses or particular communities. What are the outcomes that matter most to them? And that's the starting point. So if you take that example of independence, you can then go to the delivery system, voluntary, statutory, etc., and say, well, actually, are we structured in a way, are we organised in a way, do we work in a way that actually helps us deliver independence? And often people say, oh, yes, of course, and then they begin to think about it and say, oh, perhaps not. And then you say, okay, so what would it look like if we really were going to help people become independent? And all of a sudden, you then get an outpouring of different ways of doing things. And actually, so for example, people say, well, actually, we would invest much more in self-care. We would invest in the infrastructure that allows for the time banking, for the community development side. We would move our specialists out of the hospital. We would develop multi-professional teams with social workers working alongside the voluntary sector and the medical staff, and so it goes on. And very quickly, people come up with a view as to actually there are very different and better ways of doing this by working very differently. And then say, but we can't deliver it because we're all working in our separate silos. We've got the GPs over there and the social services over there and there's hospitals organised by livers. And you say, well, but why does it have to be like that? Or why not actually change the way in which you organise your delivery teams so people work more cooperatively together? And that's the organisational reform piece. And actually there are more and more policy levers that actually make that more possible. And the other reason you can't deliver it is because the payment mechanisms are wrong. So if all your doctors get paid to go and do outpatient appointments, or if all social workers get paid to go and visit people for 5 minutes at a time or whatever it is, that's hardly probably the best way to create the incentives to deliver the model you've just described. So to get the change to happen, I think you need to address all of those blobs. And every part of the system has to understand its role in the dance. Dialogue with the public to define the outcomes, consideration of what the new service model needs to look like, and then how do you need to organise your staff to be able to deliver those new models of care, and what's the payment mechanisms you need to provide it. And that payment mechanisms is, I would suggest, a large chunk of the commissioner's role, and alongside it, I think the incentive and the population outcomes piece together become a system leadership role. So I think there's a big leadership role for a council seeking to work cooperatively. This is just to say that this is now speaking more to the specifics of the commissioning agenda. So outcomes, what sort of contracts you can reward outcomes, which that's the bit without capitation. It's essentially another form of pay for performance, which is better than just paying for activity, but it doesn't actually correspond to the task of the system, which is to make the most of the money you've got. And that's the bit with, if you put a C in front of the outcome-based commissioning, you get capitated outcome-based commissioning. And that's the piece where now your incentives, if you reward people for the outcomes they achieve for a population, now your incentives for individuals and teams and organisations can be aligned with the goals of the system, i.e. getting the best value from what you've got there. And you'll find those, if you're going to contract in that way or commission in that way, there are always there's a standard 5 set of elements of a contract. There's something about the particular population, the outcomes and the indicators that goes with those, the money you want to spend on it, the nature and importantly the duration of the contract, because people, rather than letting 1-year contracts, if you can let longer term contracts, you begin to encourage investment in prevention. And you also allow providers to invest up front for a return further down the line. and then there's the commercial structure linking the incentives to it. So collaborative commissioning or collaborative work, if you're going to commission this way, all those are technical things that will need to be addressed. But it's not just a technical process, it's very much a social process designed around conversations. So if you go back to that older people and independence, you need a conversation at the beginning between the commissioners, because it's not just the council, it's not just the CCG, but there are multiple commissioners whose services or money will contribute to that outcome. And the commissioners need to work together and ideally agreeing that they are investing to achieve the same sets of outcomes. And so I think that says something about the process of the dialogue. If local government, the health service and others can have a dialogue they run together with their population, so they all agree that they've got one version of the truth around the outcomes that matter, then I think life will be much, much easier than if they hold separate sets of conversations. So that's the conversation between the commissioners to agree to talk to their public together. And then, of course, it's, okay, these are the outcomes that matter, and they need to communicate those to their providers, engaging the providers. And then the providers will need to work together differently. If you're a provider paid to improve independence, I would invest heavily in the voluntary sector to draw out that informal capacity that keeps people in their homes and away from the statutory services, and gives them a better experience of life than 5-minute visits from social workers or GPs or difficult to get on the end of a phone. And of course, the provider, if they're designing their services, should also be talking to the public about how the public want to use those services. So again, there are all those conversations that need to take place and need to be orchestrated. I want to just go on a little bit about the importance of outcomes, because everybody's got vested interests in the system, but the vested interests that should trump everybody else's are those of the publics, the people that pay for and use the service. And there's nothing quite so powerful as being able to have members of the public sitting alongside you and their exact quotes as to what comes to say, this is what people really want from the system. If you talk to a diabetic, I've never heard anyone say my goal in life is to have my glycosylated hemoglobin less than whatever it is. It's all about the life that they want to lead. And what we're finding is where commissioners do engage in this sort of a process around outcomes, they can use that as the foundation to build a much deeper relationship with our local population that can then stand them in good stead when they need to set priorities and so on and so forth about where their investment goes. So I think commissioners investing more in their dialogue with the public is a really important part of this. As I said already, if you're just working your way around that triangle, outcomes, the delivery bit, there's a huge amount of expertise that we've released and targeted at the outcomes that matter. You'll find the staff really engage with that. So where we talk to interventional cardiologists saying, actually, really, your goal is to reduce morbidity and mortality. That was a medical term for this population. He said, oh, that's the most interesting professional question I've had in the last 10 years. And came back next time and said, we've had to have dialogues with our GPs and feeding hospitals that we should have had 20 years ago. The same when we talked to people with substance misuse and said, actually, what people want is they want not just to have lower drug-related deaths and lower fewer blood-borne viruses spread, but also people want help with staying in their jobs and not losing their houses and so on and so forth. When you went to the staff and said, that's what we want you to deliver, they said, that's why we wanted to work for this service in the first place. And we've got a slew of ideas about how to do it, but at the moment we're paid to sit in outpatients. So if you get the outcomes right, you can really re-engage your professions and release the innovation which is there in spades in the fantastic people that work in our public services. And on the organisational side, so people are employed in ways that they find it difficult to work together. It's catalysing new alliances. It's catalysing mental health services, work with physical health services, the voluntary sector to work with the kids. So we're getting new alliances that have the potential, I think, to crystallise into new delivery shapes over time. They don't have to be new organisations, but definitely new ways of working together. Housing has come into some. So Cambridge down the road has had housing working with the Addenbrooks and the community services in ways that people would, I think, not have happened without a focus on outcomes. And coming back to the commissioners, it is a different way of doing things if you really focus on outcomes, and it needs not to just be a bolt-on, it needs to be the day job, it needs to be the heart of what happens, because so many other things then change around it. It's really important that it's a social process as much as a technical process, and the commissioners need to work together and to reach out in ways that go beyond current practice much of the time. There are mechanisms to build from things. So there's the Better Care Fund at the moment. Is an opportunity to build links between health and social care. In the health service, or the co-commissioning stuff about NHS England primary care, specialised services. And so there are the building blocks if people want to use them. So co-commissioning becomes essential. But it also becomes essential that commissioners reach out to their providers and spend time saying, yes, it is possible. We do want you to work differently. You probably will need to develop new partners and new skills that you haven't got at the moment. And that will mean you're probably reorganising your work, not around the trades, but around the silos, the interests of the service providers, but reorganising yourself around the problems and issues they're trying to address in the community. And we're seeing lots of places around the country, for time I haven't got a list, but where people are beginning to make those steps. And it looks like it's going to catalyse quite a significant change in the delivery side of things to deliver these new service models, some of which are really exciting. Our time is, I think, up. So my conclusion is that if you've got a council that wants to be collaborative, that sees itself genuinely as an agent of the public, if it's prepared to reach out to other commissioners, work with them to articulate the outcomes that matter to individuals and the community, and then challenge the provider community to come together in new ways to deliver it, I think there's a real chance that we can move our 20th century state designed by Beveridge to what's needed for the 21st century. And it falls to our generation to do it, because ours is the generation that's faced with that problem. Thank you very much.
Thank you very much, Nick, and it's lovely to be returned to your sort of sparkling, fast mind, so that's very enjoyable. I think it's also great that you brought us back to that theme of conversations in the strand throughout your talk, because we are about conversations and linking it to outcomes and then to relationships. And I think what I found very helpful in this contribution too is to remind us too that it's not just the grassroots that will benefit and suddenly feel empowered, but the executives, the experts, the staff in these very big organisations tasked with delivery, because you've described so impressively how they feel, they build new alliances, they suddenly feel they're back to the practice that they probably trained for, the ideals that they have. So we're liberating the staff as well as the public. And I think my question is, it seems very obvious when you say, and if we were leaders, we'd all want to do it. I mean, we are leaders, but I mean, any leader would want to do it. But how do they create that space in this sort of huge pressure of backlog and time? How are you managing to convince people to create this space for the thinking and the conversations?
There's a mixture of reasons that people go for this. Some are noble reasons at the end, in the sense that actually they believe it's the right thing to do, and they think this is the best way that they will get the best outcomes for the communities that they serve. At the other end of the spectrum, it's people who are grasping at any straw because they know that if they carry on doing what they're doing, then they're either in the doo-doo already or they're going to get there pretty quickly. And probably most people have an element of both motive in things, and particularly whether it be hospitals or councils, the financial pressures are actually making this an easier sell than it probably was a little bit a while ago. And also, the other bit is more and more official bodies are supporting this. So in the NHS, the 5-year forward view is a powerful document. You can certainly put all that organisational reform bit and frame it in those terms. You've got organisations like Monitor saying, if you're going to have an effective 5-year forward view type organisation, then you've got to change your currency of commissioning to a capitated outcome-based thing. People are saying, financiers are saying you need multi-years, otherwise no one's going to invest in your... So there's lots and lots of things. So broadly, I think it comes down to enlightened self-interest.
Is the time right? Are you optimistic?
Oh yes, I'm completely... No. I mean, the future's often easier to predict than its timing. But I think this is right, and I do think that time is to start now. Quite how quickly it becomes embedded, we'll see.
Good. Thank you very much, Nick. We very much appreciate it. So, over to the other Nick. Thank you.
Indeed, right. This is the last opportunity to
take a seat and then we'll join
our thoughts, to talk to each other, to have those conversations, come up with ideas, particularly some of the challenges Nick was alluding to there. How do we go about having those commissioning conversations? How do we get the refined preferences of our citizen consumers really understood by our public sector managers? How do we do that better? So thoughts on a tweet starting now, 90 seconds. Off you go. Thank you. Okay, ladies and gentlemen, to keep the conversation going, to keep those tweets going. Very interesting tweet up there. The future is often more easy to predict than its timing, by Ian. Talking to the public about what they need and then delivering it, VCSE model for ages. If only the money people can join in. Who are the money people? Where are they? Let's get them joining in. Just a few highlights from the tweets that were coming through as Nick was speaking. Commissioning to get better value into service delivery. What about the layers of contractors' waste? So the layers of contractors that are going into public services, how do we strip out some of that cost? At Ian Revel, Dr. Nick Hicks challenges us to think how the welfare state responds to the ageing population. We need those new approaches, and no one has a monopoly on ideas. Those new approaches can come from anywhere, at any time, from any group, and from any individual. And I think that's part of the challenge for all of us as a community, is to not shut down those opportunities for people to come up with those bright ideas. It will be users, it will be people providing those services that often will have the brightest ideas. At MK City Discovery, devolution to local government, does this require innovative, creative, cost-efficient thinking from institutions to work cooperatively? I'd say probably yes, it does. This one, focus on the things people care about the most. This is what commissioners need to think about, but therein lies the devil in the detail. How do we get to those preferences? How do we get to that understanding from what people really, really do care about? What are the outcomes they really want? And then we've got one here. Cooperative Council has a system leadership job. And then finally, from at JCO Don, Nick Higgs, outlining the challenges of structural review. The trick will be to have the conversations collaboratively. And I think that, on that note, that is a theme that has underwritten much of what we've been talking about today. So I'm going to hand back at this point to Francesca, who's going to sum up in only 60 seconds the whole of this afternoon in a pithy sort of way. Francesca.
Pithy, that's not me really, but still. I'm trying to get some sense of all the richness that we've heard today. I think this sense of mutuality has come through, and I think a recognition for all of us that we need to step up on this and also get ownership of the relationship and make sure that when we're talking with health, we're talking with the council, that we actually seize the equality agenda there ourselves, and we are an equal stakeholder in all this. And I think that's very powerful about we want the grassroots energy. We must also understand that those powers that be also need liberation, and they also need to get back to what they care about. So we have real common ground between us, but again, we must actually seize that relationship rather than stand back and wait passively for something to happen. But I think the culture of our town, the equality, it was interesting when we talked about democracy, because I agree, because there was some feedback about the corporation was a very strong deliverer, and it drove things forward, but actually it gave us all a feeling in Milton Keynes that we were part of it, very interestingly, so clearly benign tyranny or whatever it was. But I remember being in the voluntary sector early on, and actually we did get a lot of consultation. We were, at that level, quite engaged in forming the plan and developing. So I don't know how people in housing and planning felt, but it certainly felt like that at that level. So it was part of the culture there to actually value and respect. So I think we have a very strong appetite to engage, and that is something that I think is quite a very, very special part of Milton Keynes culture that we really must seize. We can't slip into a passive, unequal society, community, because then we do not respect the heritage and what we have built up together. So I think there's a huge force of energy here. Roger, in his film, showed us that we've done quite well, I think. I mean, I was wondering whether the city centre was bustling enough. I would have loved a tram, especially that picture of a tram. I would be on there all the time. And for transporting our children, who I said earlier have ownership of the town, they do have ownership, but their parents don't have to do a lot of driving to get them that ownership. So that is, there are lots of things to do, but I thought really, not bad visioning, and what we have control of, we've delivered quite well, and we must continue to have that vision. I thought when Tim was talking about it, it was so interesting that we should celebrate. Has he gone? I just saw him just now. There he is. The democratisation of knowledge. We've been right in the middle of that here. We've been sharing that great revolution with the Open University. And I think we've got very fertile territory to seize the internet and global opportunities here and really embrace it. And as we said, there are technical issues to make sure that we do have a broadband that we can really embrace it. But again, respecting our heritage here, and we've been at the centre of something quite enormous. We are with smart cities at the sense of something, at the start of something technologically revolutionary. He was talking about the redways going into the rural areas, weren't you? And of course those little, what are they called, hubs? The little electric things that are going to go up and down. That is, that future's starting to happen. And so it'll be fascinating. Abigail reminded us again of our need to develop the grassroots energy and step up, I think, with that, because we cannot sit waiting for others to lead. They must lead, but we must also lead. And you celebrated the fact that we had actually called this conference and debate and started to engage the conversation from the community side. We put the effort into this, and I think that's vital that we continue to say we are an equal partner in this conversation and we want to give those platforms. My question to Nick was, how do we encourage that dialogue? And actually this is one way. We actually invite people in to talk with us. Jonathan showed us a real structure of how to engage in a much wider way, which is very exciting to see. And I've felt talking to you that it's a way of giving people a way in when they might otherwise not be sure where to start. And you can see that ball rolling and more businesses coming around it. So it is a real way of connecting. And Darren gave us a great sense of, I find this word so hard, reciprocity, but I'm almost there. I'm practicing it there, but I'm not sure I got it. But we talk a lot about business engagement. We've talked endlessly about it in education, in the communities. It's going to be the solution for everything. But my goodness, you have shown what business engagement really is. And it feels to me that in terms of action, you just said this is an area that needs something to happen, and you went boldly in. And you're not finding it as hard as you thought, Ed, probably, when you were planning. Because once you're in there and you understand the culture and you respect the offenders who have potential, then it all starts to move. And I thought that was a great inspiration to us. And Nick, the call to the experts, lost him again, where has he gone? Over there. The call to the experts to invest in the agency relationship and develop a new sort of language feeds again into what we had a lot of early information about, is that this is about conversations, about shared values, a shared narrative, and we have so much to draw on in Milton Keynes in terms of a shared narrative that we don't want to lose some of our values and our vision, because this is an equal city. And it is a city of partnership. So I think, perhaps in conclusion, that we need to find some projects to engage in, but we need to continue this dialogue. If nothing else, let us invite health in next time we meet and say, how do we actually form a common vision? And how do we liberate you hard-working health staff, into actually talking about the things that matter to you? Because same with the council workers. They came into this business because they care passionately about communities and education, and they are having to juggle a lot of balls. So I think that the grassroots must push up their energy and get engaged. The business should be inspired by Darren's example and actually find that it does a lot for their employees and their culture and their sense of who they are in the community and the country. And our deliverers like the council and health are also needing to have a new dialogue. So altogether we form a whole new partnership which is full of respect and shared values. And I think the very important part is to create the space to think and reflect. and make those changes, because it will be so easy to go back to our desks and say, I've got 30 things to do, and it'd be a nice idea to create space. But I think, as Nick said, this may be the time, because we have our 50 years coming. There's massive change out there. There's massive financial change. And I think if we stand and watch, we will look back and say, what did we do? Because that was our moment to do it, to actually really affect change and be part of the dialogue. So we need to find some projects where we can get our sleeves up and start the dialogue and see some action, so we feel that we're not just talking. But at the same time, today I think we've got a lot of talking that have actually developed a sense of who we are and what we want. I certainly feel that, and I hope you do to feel that we are moving into some sense of what we must continue we must wave our flag for Milton Keynes and carry on, because we have another 50 years in our sight almost. No, I won't live that long, will I? But no, almost. I could live 30 years if I'm hopeful. So thank you very much for your attention, for your tweeting. I know it's hard for some who can't do the twittering, but maybe it will inspire us Luddites. You see, I can't even operate this, so I certainly can't Twitter. But I think that we will gather. Is that right, Julia? We will gather. And the wider team, it's not Julia, the wider steering group will gather some of this and try and bring it into some coherent form that actually will incentivise us to go forward. So on that basis, big team, thank you steering group for stepping up and seeing the challenges, getting together in the first bit of cooperation and partnership and saying from I won't name you all, but there are many people in that steering group to say we must do something and make all this cooperation happen. Thank you for the OU for its generosity, for its wonderful technicians up there who are, well, great team, and they've often supported community events here. Thank you to all the partners behind the scenes who have also encouraged and developed this. Thank you for the speakers, because you've given us your very, very important time. You've actually given us, most of all, your very important insights and developments. And, what is she looking? Is that my time to go? And, you're waving at something now. This is... Oh, yes, very important. Very important. The most important thing is that we want you to take that postcard you have in your pack and write a key thing that you would like to see taken forward or that inspired you, a call to action, what we could do. It doesn't have to be all those things. Just choose something that hits you. And we really, really need that, because we want this to be a group of action, not just reflection. And to end on that, we're going to drinks down there. I've timed it beautifully because they were going to be ready by 5, so I'm waffling on, but it's good because we've landed at 5. I just want to thank most of all of you, because taking the time to come shows the appetite and energy and your contributions have fed into this dialogue and conversation and cooperation. So thank you for being a living example of conversation and cooperation. Thank you.